living with diabetes can be a lot of work. All those finger sticks and injections, trying to remember the tricky carb counting, and of course, the constant worrying can make it seem like a 24/7 job. Or you can let the MiniMed 780G system do most of the work for you. The MiniMed 780G is the only system with meal detection technology that automatically adjusts and corrects sugar levels every 5 minutes, giving you more insulin when you're trending high, less insulin when you're trending low, every 5 minutes. So even if you undercount your carbs or occasionally miss a meal dose, the system can automatically help correct for it, providing real-time insulin adjustments and corrections all day and night. And put your worries to rest. The MiniMed 780G system, designed for real life.
So much for joining today's live stream. My name is Paula Mora, and I'm a clinical specialist here at Medtronic Diabetes. I'm a registered dietitian and a diabetes educator, and have been a part of the Medtronic family for 8 years now. But most importantly, I have the pleasure of moderating today's program. So I did the math a little earlier today, and it's really hard to believe this, but it's been over 6 months since we received FDA approval for our MiniMed 780G system. And I have to say, we've had so much fun sharing the ins and outs of this incredible system, and are just equally as thrilled to be able to talk about it today with you in case you haven't had the chance to join us before. Let's move on to the next slide, because before we get to today's content, I'd like to just share our guiding principle with you. At our core, we are committed to making your journey with diabetes easier and your outcomes better. In the simplest of terms, our North Star is all about reducing the challenges that you face in your day-to-day diabetes management. And as you'll learn today, the MiniMed 780G system does just that. Let's move on to the next slide so that we can look at today's agenda. So this is a little bit of an overview of our plan for our time together today. So first, Ali Giannotti is going to kick things off by walking us through an overview of the MiniMed 780G system and meal detection technology. Courtney Giles and Bill Atkins are then going to share their personal experiences on the MiniMed 780G system before Anvita Kumar shares the details you need to know if you are interested in getting the MiniMed 780G system. We will then spend the bulk of our time on what's most important, which are, of course, your questions, which reminds me, you can ask questions at any time in the Q&A feature that's next to the video player. And I never remember if it's here or there, but the video player, that's where you're going to plug in your questions. We typically get a lot of questions, which is wonderful. In order to make sure that we get to the majority of those, we have a dedicated group of friends that's working really hard behind the scenes to respond to you directly. We have also been paying very close attention to our social channels and have already collected some FAQs, or frequently asked questions, that we're going to be sharing before the live Q&A section of our program today as well. So on to the fun stuff. Yeah, let's move on to the next slide. I now have the privilege of introducing you to Ali Giannotti, who is the Senior Vice President of Product Innovation and Operations here at Medtronic Diabetes. Ali, take it away.
Thanks, Paola. So I have the distinct pleasure of describing to you what the 780G is all about. And so if we go to the next slide as an overview, the system may look very, very similar to what you have seen from us in the past, but I want to make sure that people realize that everything inside of it has been improved and is different from our past. Starting with thinking through even the infusion set, we have made massive improvements with what we call the extended wear infusion set, where now you can maintain that set for up to 7 days instead of the typical 3-day wear. Aside from that, though, with the system itself, we've gone ahead and improved the sensor as well, and it now no longer requires finger sticks and doesn't alert or alarm as much as our previous technology used to require, mainly because we have made advancements on not only the accuracy, but the performance of the sensor itself to eliminate it. The other thing that we've done is improve the algorithm rather dramatically, and those improvements have yielded the ability for us to keep people in SmartGuard technology 95% of the time. And what we're seeing in the real world, and I'll go through some of those results later in this presentation, most of the time what we see is the reason why people are getting exits is because they don't have insulin in their reservoir, their set may have gotten plugged up, or their sensor has expired. And other than that, the system is able to take care of the people's insulin needs readily and stay in that SmartGuard technology as we go here. In addition to all that, we have improved our mobile app and actually added in Apple Watch capability as well, so that you could see whether or not you're in SmartGuard and what your glucose levels are directly. And if you wanted to see a specific trend, you would push on the watch and feature, and you would actually see the trend, or go back to the phone and see it there readily. But most importantly, the thing that we've made a difference with is with the algorithm. And with that, we have now made it not only improve on the basal insulin dosing that it provides, but it also now can correct and even go beyond that and help with carb counting as well, because it can detect meals also. And really what that means is that it's able to be a lot more forgiving in the cases of, well, quite frankly, carb counting may be off or an error, or life happens and you forget to bolus. And so with that, those auto corrections are able to help keep people in range because it's able to deliver that insulin on a 5-minute to 5-minute interval and provide that dose that's required to keep people from going excessively high. In addition to that, and I'll go into some more detail on the specifics here, but we've actually lowered the target that the algorithm is shooting for down to 100 milligrams per deciliter and made it programmable so that folks can choose 110 or 120 depending upon their needs. And then last but not least, and as I had mentioned in the previous slide, we've gone ahead and decreased the number of alarms and alerts and allowed for the technology to be maintained for extended periods of time now as a result of removing many of the safeguards that we had previously in the algorithm, and therefore able to keep people in range more readily and achieve 95% of the time being spent in the SmartGuard technology. So if we go to the next slide, I could give you some details on the specifics here. And so the first change that we've made within the algorithm, as I mentioned already, is the selection of a lower target. And in our case now, we're able to offer the lowest target available in any other technology on the marketplace, with that being at 100 milligrams per deciliter. Now, that's the default for the device, but it is programmable to 110 or 120, depending upon a person's needs. Thinking about the kids as an example, for those children that are under 15 years of age, we actually recommend a target of 110 milligrams per deciliter. Now, the beauty and the advancement that we've put into this algorithm is the ability to autocorrect. And what we mean there is, in case you've miscalculated how many carbs are in that meal, maybe undershot it because you weren't sure, or even more readily, what we see a lot of the times that people forget, the system is able to provide additional insulin in order to make up for that difference. And it does that only in certain cases. And those cases are, first and foremost, when someone's sensor glucose value is above 120 milligrams per deciliter. And then secondarily, their autobasal that we calculate and provide to folks is at its maximum. And therefore, those two things allow the system then to start providing autocorrections on a 5-minute to 5-minute interval. So once again, what needs to happen is that your glucose level needs to be above 120 milligrams per deciliter. And we've already attempted to give you the maximum amount of basal insulin that we can based off of what the algorithm calculates. After that, it will start providing corrections. So if we go to the next slide, the other thing that is built into the system is the ability to detect when a meal has been consumed and, quite frankly, someone hasn't bolused for it. And the reason why this is important to us is because we can actually become much more aggressive with the algorithm, provide more insulin to make up for the fact that those carbs were not entered. And so the way that the system works is very simple. It's actually looking at that rate of change in the sensor glucose graph, plus additional parameters within the algorithm itself, and looking at your past history as well to notice whether or not this is normal for you or not in terms of how fast your glucose is rising. Now, if it detects that glucose is rising similarly to when a meal is absorbed, then it'll go ahead and provide additional insulin beyond the corrections to make up for that difference. Now, this doesn't mean that somebody can be completely hands off the wheel. We're hoping to be able to do that in the future, but instead it becomes a lot more forgiving in its ability to provide insulin and keep people in range because it sees and reacts a lot faster. And it's able to make up for that difference sooner than anything else that's in the marketplace. So if we go to the next slide, and thinking through some practical examples here, and one of them being something as simple as trying to have a couple of slices of pizza, the first thing that probably comes to mind is, well, how many carbs are in those 2 slices of pizza? And then the next question is, well, how thick is the crust? How big is the slice? How much cheese is on it? The questions keep mounting and mounting and mounting, and then ultimately, well, let's face it, we can make a guess as to how many carbs are in each of those slices of pizza. And the intent of our system is to actually make up for those guesses. It's anticipating and expecting that the data that's provided is helpful, but not perfect. And as a result of that, we'll make up the difference and do what it needs to do in order to keep people in range by adding the insulin necessary to get back to those targets. 120 milligrams per deciliter for the corrections, and depending upon what you choose, 100, 110, or 120 for the target thereafter. And so ultimately, what we're trying to do is make up for something that's an imperfect science, which is carb counting. And the system is designed to handle that. So if we go to the next slide, really what it's doing is emulating what a pancreas would do. And simply put, it's looking at the demand based off of the sensor glucose reading, and then adding in the supply. So if we start first and foremost with a few examples, the one on the left here, and you see on the very bottom left, someone is eating pizza. Now, the 2 examples we have here is a person with diabetes and a person without diabetes. And the fact is that in this particular example, the person with diabetes forgot to bolus. And typically what you expect is for their sensor glucose to continually rise as people are digesting that pizza. Now, when we came up with the advent of the hybrid closed loop systems, as you can see, when someone ingested that or went ahead and enjoyed that pizza, the hybrid closed loop system would try to keep up and provide basal insulin up to a maximum. And that's what you see in those gray bars in the middle there. It's providing, but then it can only hit a certain maximum before it can't do any more work. And at that point, you would still see the sensor glucose continue to rise and probably continue for some period of time. Now, with the advent of the MiniMed 780G, the thing that we've been able to do is now add in auto corrections to increase the amount of insulin that we provide for that meal on a 5-minute to 5-minute interval, and continue to do that until we bring people back down to this target. Now, in saying that, this is the closest thing out there to what we would see with someone with a pancreas that's able to provide insulin. And so what we're trying to do is emulate that the best way that we can through seeing what the demand is and providing that supply and doing it as soon as possible. So instead of waiting or seeing where a person's sensor glucose would end up an hour or some period of time later, we're actually looking and calculating every 5 minutes to see how fast someone is rising, how far away are they from the target, and as a result of that, providing the insulin they need to bring them back down. Okay. If we go to the next slide, and I'll share with you a practical example, and then Courtney and Bill will give you their experiences as well with the system. But in this particular case, please meet John. John has consumed 75 grams of carbs and is today using a sensor augmented pump. So he's basically what we would historically call manual mode, means that he has programmed basal rates and no automation built into his system. And he goes ahead and has that meal and forgets to bolus for it. And what you'll see on that left graph is that his sensor glucose would rise up and then continue to rise up as a result of ingesting that meal and forgetting to bolus. Now, of course, someone without diabetes, what you would see is, yes, a rise would occur, but then they would come right back down to somewhere in the order of 100 milligrams a deciliter, because their pancreas would provide the increase, the insulin required, and get them back into range. Now, on the right side is the same meal that John ingests, but now with the auto corrections included. And what you'll see in the green is the basal insulin increasing to a point of reaching its maximum. And then in black, the auto corrections coming in to essentially add in that additional insulin needed for that bolus that was forgotten and make up for that difference. And as you can see in this particular case, 8 corrections were provided over a very short period of time to make up for that difference in terms of the insulin that was needed in order to make up for that meal. And the system will readily do this, and you'll see it from time to time if you have the chance to actually wear it. It will come and it will go in terms of the corrections to make sure that on an ongoing basis, it's not providing too much or too little insulin to make up for that difference. So if we go to the next slide, I wanted to share with you some results that we're seeing now that, as mentioned, we had the approval about 6 months ago and have actively been providing this to people across the U.S. and have seen great success with it. And so what you're seeing here is our first 7,500 people that have been on the system, and with it, you're seeing that their average time in range is at 77%. Quite good, considering that the ADA guidelines tell us that we need to be above 70% time in range in order to achieve good glycemic control and avoid long-term complications. So in general, people are doing quite well on the system. But in addition to that, what we've been recommending in terms of settings for the device is first and foremost picking a target at 100 milligrams per deciliter. And then another concept that I'll mention is the notion of active insulin time, which really comes down to how fast do we want these corrections to bring someone back to target. In our case, we recommend 2 hours for that specifically, but it's programmable to 2.5, 3, 4, 5 hours, depending upon a person's needs. But in the case of when we've asked patients to go ahead and use our recommended settings, we see that 1,650 of these 7,499 folks chose to do that. And of them, they were able to hit a time in range of over 80%, 81.4%, with good glycemic control. And the reason for that is, again, because of the forgiveness of the system, the forgiving notion of the system, and these auto corrections bringing in the insulin needed to keep them out of the high ranges. So now if we really quickly, I'd like to share a video with you demonstrating the meal detection technology in a practical way, and hopefully you enjoy it. So with that, let's start the video.
Guess it's time for lunch. Yum, burgers. Let's see, how many carbs would that be again? Wait, how many carbs are in a burger? How much insulin for a burger? Can't you forget to calculate for fat? 15 minutes have passed. Okay, should be good to go. I'm not feeling too well. I must not have counted correctly. I need to give her a bolus correction.
You need something that has your back when life happens. With the MiniMed 780G system's meal detection technology, counting carbs and occasionally forgetting to bolus no longer have to be such a big worry. Every 5 minutes, the system automatically checks, self-adjusts, and corrects insulin delivery to ensure you have the right amount your body needs, 24/7.
Oh shoot, I was so nervous I didn't even bolus. First date is not the time to make a bad impression.
Wait, I'm wearing my MiniMed 780G.
What a relief.
If the system detects a meal, it automatically delivers more frequent correction boluses to make mealtimes easier. The system works overtime, so you can spend less time managing highs and lows and more time enjoying the moment. Learn more about meal detection technology at medtronicdiabetes.com/780G.
I just love that video. It's great. Thank you, Ali, for walking us through that first section on the overview of the MiniMed 780G system and meal detection technology. So I'm actually going to give you all a heads up. Ali isn't going anywhere. If you have questions, he's going to stick around for live Q&A. So make sure to send us those questions through the Slido as you've been doing this time. So next up, we have the pleasure of introducing you to two very special guests. Bill Atkins is a Medtronic ambassador who has lived with type 1 diabetes for 39 years. He hails from the Garden State of New Jersey, so close to me. Hey, Bill. And Courtney Giles is a Medtronic employee. She's lived with type 1 diabetes for 22 years and is joining us from Dallas, Texas. So let's kick things off with Bill. And Courtney, I'm going to come to you immediately after. We've got a couple of questions for you. So let's kick things off with Bill. So Bill, if you could sum up the impact that the MiniMed 780G system has had on your diabetes management in, say, one or two words, what words would those be? Oh, you're on mute, Bill.
I think for me, to sum it up, I've gotten my life back. And as you alluded to, as someone with diabetes for a long time, I've been from pre-technology to current technology, and boy, has life changed along the way. So being able to live my life sort of like a non-diabetic is a real wonderful thing that I'm experiencing, especially from where I came.
That's great to hear. That's great to hear. Courtney, anything to add there from your perspective?
Absolutely. Thanks so much for having me today. So if I had to choose one word for the MiniMed 780G system, I would choose freedom. So in my personal life, I love to travel, and the 780G system has given me the ability to flex from my normal schedule and not have to worry about my blood sugars because it's doing it consistently in the background, trying to drive to a target for me. And then as far as work goes, I am a clinical trainer here at Medtronic. So it is revolved around diabetes. I talk about diabetes all day long, training patients, talking about carb counting, and it really, the 780G system allows me to do that without having to worry about my own at the same time as well.
Awesome to hear. Thanks for sharing, Courtney. I'm going to come back to you, Bill, because I know you've been using the system for several months now, and we do have a lot of people on the line today that may be on multiple daily injections or other pump systems. So thinking of that, what is one thing that you'd want to tell them about your experience with this system? And Courtney, of course, I'm going to come to you after with the same question.
Sure. So one thing I could say is I've been right where you are before. I was dealing with multiple injections. I was taking the same amount of insulin, not knowing where it was. There was pre-CGM. So the only time you'd find out where your blood sugar was is every 3 months when you went to your doctor, he would tell you what the last three were by an A1C. But the next day or that day, you'd go back to having no clue. By using the 780, I'm constantly being analyzed by this technology. I'm constantly getting those 5-minute auto corrections when I need it without me having to do anything. And it's been such a transformation to get a free life. Luckily, I travel a lot. I don't have to worry about carrying all the stuff that I did with me, constantly checking in, eating at certain times. You know, my kids used to kid me when I was little that dad had to eat at 12 noon, dad had to eat at 6 o'clock, because that's what my either my insulin injections or my pump was telling me to do. Now I can miss a meal, or I can live like a regular person and have that meal and not worry so much because that correction is going to happen with or without me. So it's really given me the freedom that I've never had in the long time that I've had diabetes.
What do you had to add there? I'm sorry.
Yeah. So as far as starting on pump therapy, I think it provides a flexibility that multiple daily injections really can't match. And it's being a pump user for many years, it's something that I never could go back to after starting on pump therapy. It really is indescribable what it can provide in, trying to live a more normal life, but living with diabetes as well. On the patient side of things, I know my patients really love with insulin pump therapy, and specifically the MiniMed 780G system, the flexible targets of 100, 110, and 120. The interface is really user friendly, super easy to use. The shortcuts with the 780G system, only having to press a few buttons to give yourself insulin, really, instead of having to do your shots, multiple shots a day, it really is the push of a button to help get your blood sugars where they need to be. Beyond that, Medtronic has abundance of training and support that we offer. And so you can rest assured that we always have your back.
Thank you, Courtney. Bill, you alluded to this a little earlier. I know you've lived with diabetes for a little over 3 decades now, almost 4, and you've used several different pump systems. So if you were starting with technology as opposed to being new to it, right? If you were starting on this pump as opposed to being completely new to it, how do you think that it would have changed your diabetes experience? Just being like a brand new person and going straight to MiniMed 780G system, how do you think that would have changed your experience?
Sure. So I think of not having the 780 system, if I was coming to it fresh from never using it, from maybe being on multiple daily injections, it's going to be really hard to trust the pump, because as a type 1 diabetic, we are constantly overwhelmed with making those little adjustments, hoping that we get things right. Our goal is to really stay in tight control so that you won't have complications. I'm 64 years old. My last endocrinologist appointment, my doctor was saying, Bill, you've had type 1 for 39 years. You have no complications. And I didn't do that alone. I did it because I have this technology that has helped. So going from the constant interaction that we all had, that monkey on our shoulders, so to speak, to letting this pump do that for you and trusting the technology, it's a hard thing for people to get used to. But once you do, it's really freeing. So it's a radical change from pre-technology. And luckily, the people who are thinking about coming to it now, they're coming on it when it's so advanced. So they're going to get all those benefits now that those of us previously didn't have available.
Good point. Courtney, what about you? Do you think this would have changed your diabetes experience? And if so, how would that have been?
You're muted.
Oh, you're muted.
Sorry about that, guys. I think of the question, if I would have had access to this type of therapy sooner, what it would have done and changed in my life. I want you to picture a 6-year-old little girl, Courtney, getting diagnosed with type 1 diabetes in the hospital. And she sits there and just accepts it. And she looks next to mom, and mom's crying. And she says, "Mom, why are you crying? Grandma has diabetes too. It's going to be okay." And I kind of had that idea, that thought throughout living life with diabetes, but it really wasn't until the MiniMed 780G system that it let me live a more normal life in being able to, not worry about my diabetes as much, and really have that life that 6-year-old little Courtney wasn't scared of or wasn't afraid of.
I can picture you. Thank you for setting that scene. I'm going to stick with you, Courtney. I know that you're using the MiniMed 780G system with Guardian 4 sensor, as well as the extended infusion set, right? Kind of the whole kit and caboodle. Can you tell me, and the audience, of course, a little bit about how this is different to your previous system, your previous infusion set that you were using?
Yeah, of course. So being a pump user for many years, changing infusion sets every 3 days really did become burdensome. And so I started on the extended wear infusion set, and I had to remind myself in the middle of the week that I didn't have to do those changes anymore. And that is all thanks to Medtronic, especially being a leading innovator in the diabetes community, taking that next step and making the 7-day wear infusion set that you can only get here.
And Bill, I know you're on the same team, right? 780G with Guardian 4 sensor and with extended infusion set. Can you tell us a little bit about your experience with this, whole kit and caboodle versus the last one?
Certainly. So again, as a longtime pump user, one thing that's been freeing is I don't have to poke my fingers as I once did. And that alone is a life changer. As far as extended infusion sets, having to only change once every 7 days is really, people who've never done it can't possibly understand. But again, it's just another freeing experience. Even the thing of having batteries in a pump that you only change every 2 to 3 weeks. All these things are helping me to be almost like a non-diabetic. So those of you who are considering it, you're coming in at a time that you don't have all the burdens that we did. And luckily, with this technology, you won't have any complications or lessen your chance by keeping really, really tight control.
I'm hearing freedom, I'm hearing flexibility, all great things. So thank you both for being so candid and being, so willing to just share your experience with us, because obviously that's the most powerful message that we can pull from today's program. So thank you both for being here. Stick around. We will certainly be pulling you in for live Q&A as well. So we'll be back. All right. So let's move on to our last section before Q&A. I'm going to pass it over to Anvita Kumar. Let's move on to the next slide. She is our product specialist for commercial programs. She's going to talk to you all about how you can get the MiniMed 7 ADG system, because I know there are questions around that in the Q&A as well. Anvita, it's all yours.
Awesome. If we can go to the next slide for me, please. So we want to be your partner in diabetes care. So there's a lot that Medtronic offers to make sure that you're supported, not only from when you start with onboarding support, making sure that you have the training, and that will continue as you use our products. But then also with our technical support, our team is available 24 hours a day, 7 days a week. And also you can do a lot of anything where you need replacements, or if you need loaner pumps, continuation of therapy, you're going out of the country and you just want to back up. We support you all the way through all of those items. And on top of it, not only do we want to make sure that you're doing well on therapy, we want to make sure that you can get your supplies and order all of those when you need them. And so we have diabetes.shop, which is our online store, so that you have access to that also 24/7. And we want to make sure you have access to therapy. So there are a number of programs that we work on from Access, and then also our ambassador programs and diabetes education. So you're supported throughout the entire journey. So if you go to the next slide, I want to take a little bit more time to go in through diabetes.shop. So diabetes.shop is really our go-to website. You can order your supplies from your infusion sets to your sensors. You can request placements. You can also put in your product orders. We'll go through that in a little bit. And what's really nice, and what we did with 780G specifically, is now there's a lot of online product training. So if you're upgrading from 770 to the MiniMed 780G system, all that training now happens through diabetes.shop, and there's a plethora of different videos and things that you can look at as you get on the system. So what is the easiest way, and how do you place your order for 780? So if you go to the next slide for me, if you are a current patient and have a diabetes.shop account or need to create one, you can create one on diabetes.shop. And so after that, you'd sign in and place your order for one. And then if you go to the hamburger, which is on your left side, so if you can click for me, that hamburger and click on that once you've signed in. And if you go to the next piece, yep, you will now see in that hamburger menu to upgrade to the MiniMed 780G system. And so through that, it will provide it right there, and then you can place your order, and that will include the pump and Guardian 4. So you'll have the whole piece there. And then if you want to add extended infusion set, you can do it through that piece as well. If you don't have a diabetes.shop account, or you are not with the Medtronic family yet, you can place an order for the 780G system by calling 1-800-646-4633 and select option 3. And we will have a specialist call you and talk through your options so that we can get you on the product as soon as possible. And so with that, I think, Paula, we're going to Q&A.
We are. Thank you, Anvita. All right. So I did notice some questions come through before and during the presentation. So thank you all for those. As a reminder, we're going to continue to use Slido to capture your comments, your questions. So to use that Slido, you all you need to do is just pop that question into the Q&A feature that's next to the video player. If you've seen that someone has already asked a similar question, what you can do is you can upvote that question so that we can get to it sooner. Regardless, we are going to get to all of your questions, if not live, then certainly after today's session, and then we're going to share those with you. We have noticed that a lot of the questions you're asking, we already have in a frequently asked questions document on our website, or actually on our website. So if we end today and you haven't gotten the answer to your question that quickly, feel free to check out our website. We have a lot of great information there, and inevitably, I'm sure you'll be able to find the answer to the most commonly asked questions. So anyhow, before we get to those live questions, I'm going to walk you all through the top 9 that we've gotten to date. And again, we have pulled these from our socials. So it's a really good reflection of what's really kind of out there and what your main concerns are. So the first one, Anvita just went through, so I'm going to answer it very quickly. It's how do I order the MiniMed 780G system? So you can do that through diabetes.shop. And we are going to continue to work with your healthcare provider, or work with your healthcare provider to get a new prescription so that we can get you the MiniMed 780G system as quickly as possible. The next question is, what is the difference between the MiniMed 780G system and the MiniMed 770G system? So the MiniMed 780G system, as Ali mentioned in the beginning of our program, is the only system that has that meal detection technology that provides those automatic adjustments and corrections to sugar levels as frequently as every 5 minutes. And the MiniMed 780G system, or I should say the insulin pump, pairs with that Guardian 4 sensor, which means that there are no finger sticks required in SmartGuard technology. And then, as Courtney mentioned, the new system also allows you and your healthcare provider to choose between those selectable targets. So that's 100, which is the default, and the recommended setting, 110, and then 120. So those are some of the most important differences between both systems. The next question is, I have a MiniMed 770G pump. Will I be getting a new pump or software only? And the answer here is all MiniMed 770G pumps are eligible for that software upgrade and do not require a new insulin pump. And then all MiniMed 770G pump customers, regardless of your warranty, will have access to the no-cost software upgrade to the MiniMed 780G insulin pump until April 27th of next year, of 2024. A new prescription is, of course, required. And then for all other Medtronic pump customers, you can actually go on to diabetes.shop and look at your upgrade options there. Next slide, please. Okay, so the next question is, I'm actually on another company's insulin pump, so what are my options? And we'd love to get you started on the MiniMed 780G. So if you use an in-warranty pump from another company, you can actually upgrade to our latest technology for the $499. And if you are using an in-warranty transmitter from another company for your sensor, you can upgrade to our latest transmitter technology, which is the Guardian 4 sensor, for $100. And then that includes 1 box of the Guardian 4 sensors and, of course, a Guardian 4 transmitter. The next question is, will I still need to do finger sticks? So no finger sticks are required with SmartGuard technology. You will need to do a finger stick to enter the SmartGuard feature, and with, of course, all CGMs, if your symptoms don't match the way you're feeling, the sensor glucose reading that you see on your CGM, then of course, we would encourage you to check a finger stick. But again, no finger sticks are required with SmartGuard technology. And then the next question, and I've seen this in the slide already, so we will reiterate it here, is the MiniMed 780G system available through Medicare? And yes, the MiniMed 780G system is covered by both Medicare and Medicare Advantage. Next slide, please. All right, the next question. How do those on older insulin pump models, or an older model of an insulin pump, order the MiniMed 780G system? Again, just reiterating what Anvita shared a little earlier, but the ordering process is very similar regardless of the pump that you have. So if you have an older model pump, you can still place an order through diabetes.shop. The only difference is that you will receive an actual hardware, like new physical pump, versus that software upgrade that's available with the MiniMed 770G insulin pump. Then the next question is, what smart devices are compatible with the MiniMed 780G system? Saw this in the Slido as well. So you can check if your smartphone or your Apple Watch are compatible by going to our compatibility tool on our website. And that's the link that you see on the slide here. I know that a couple of people have asked about this in Slido, and we've also added the link there. Again, you can go on our website and find it. You can also just Google MiniMed 780G compatibility, and then you'll find the link there to access. And then the last question I have from the FAQs is, do I need a new prescription? We mentioned this before. Yes, a new prescription is required for the MiniMed 780G software upgrade, as well as the Guardian 4 sensor and the Guardian 4 transmitter. Okay, that's it for our top 9 FAQs. We're going to get to the questions that you've sent in. And again, one more time, you can ask questions in the Q&A feature next to the video player. So keep on using that if you have any other questions, or as I mentioned before, you can upvote any other questions that are on there that are similar to what you're wondering about. So we're going to go to the very first question, and Ali, you are going to be a very popular speaker here tonight. So I'm going to come to you, of course, for the very first question, which is, will the MiniMed 780G system automatically give insulin for early morning high sugars or dawn phenomenon?
Yeah, the short answer to that, it actually doesn't care about dawn phenomenon or not. It's looking to make sure that it's attempting to get you at target, back to target. So in the morning, if you happen to be above 100 milligrams per deciliter, if that's the target you selected, it will keep adding insulin to get you right back down to that number. And of course, do that safely to avoid any hypoglycemic events. And so generally speaking, it kind of doesn't matter the reason for it. The way that the algorithm is set up is to maintain and keep you at that 100 milligrams per deciliter target, and then add the insulin it needs, either in a correction or basal insulin, to make up for that.
Thank you. Thank you, Ali. Okay, I'm going to actually come then to Bill and Courtney. This question, I may kind of kick things off and then bring it over to you all. So the question is, can I start my MiniMed 780G with Guardian Sensor 3? And the answer to that is yes. And how will it work when I'm ready to switch to the Guardian 4 sensor? So Courtney and then Bill, did you start on Guardian Sensor 3 and then move on over to Guardian 4 sensor?
I actually did. I started on the Guardian Sensor 3 and used that for about a month or two, and then switched over to the Guardian 4. I actually had 2 patients that I trained today that did the exact same as well.
And how was that?
It worked great. They will continue the calibrations with the Guardian Sensor 3, but get the benefits of the algorithm with 780G. And then we'll be switching over shortly to the Guardian 4 sensor.
Great. How about you, Bill? Did you have the same experience? I can't remember if you started on GS3 first.
Yeah, I started both with the 780 and the Guardian 4 on the same day. And so that was a life-changing thing, from going from where I was to where I am. And then additionally, the no finger pricks. I can't ever go back to something that's going to make me poke my fingers. So as soon as you can, get to Guardian 4, because again, the freedom of having your fingers not poked and the time it takes really, really works out well.
Thank you, Bill. Ali, I'm coming back to you. So how does the MiniMed 780G system protect against low sugars and taking too much insulin, especially with the 2-hour active insulin time? And a piggyback is, can the system stop insulin delivery for me?
Yeah, so starting with the last question first, it will absolutely stop providing insulin if it's predicting that you're going to fall below 70 milligrams per deciliter. And even with these corrections, it's doing the same thing every 5 minutes. It's doing a calculation to see that the insulin it's adding would not predict to go low, below 80 in the case of the corrections. So it's doing a 2-hour prediction and then checking on those corrections to make sure that the amount of insulin provided would never create a situation of getting someone to go below 80. And then when a meal is detected, it actually increases that prediction window up to 4 hours. It's looking 4 hours out to make sure that someone isn't going to go below that 70. So it's actively calculating on a 5-minute to 5-minute interval the prediction of whatever insulin it's going to calculate to provide to you. And then as a result of that, avoid those hypoglycemic events because it's basically going to back off on the insulin if it thinks that there's an opportunity for you to go low.
Wonderful. Thank you, Ali. And Vita, I'm coming to you. So if someone doesn't have a smartphone, like a compatible smartphone, can they still use the MiniMed 780G system?
Yes, so you do not need a smartphone to use the 780G system. The pump and the CGM all work together. The benefit of having a smartphone is that you can see all the information on there, but it's not needed to do it. That being said, if you are upgrading from the 770 to 780G, we do need a phone to do that upgrade process. But if you don't have a compatible phone, you can work with the clinical team, or we can send you a phone loaner or a loaner phone that will help you through the upgrade process so that you can get on our system and experience those benefits.
Wonderful. Thanks, Anvita. Ali, coming back to you. So does the system decrease the amount of insulin that you would normally take at meals, that mealtime insulin?
Well, that depends. And it depends on a very simple thing. If we have already detected a meal and have started correcting for it, then it would, when you entered it, let's just say you forgot to bolus for a meal ahead of time. And now you've already consumed the meal and it's half an hour later after you've eaten. And during that time, the device has gone ahead and added insulin to make up for that meal. What will happen is if you came in that 30 minutes after you've eaten and provided a carbohydrate count for the meal that you already consumed, it will knock down that bolus as a result of the active insulin that the algorithm has already provided. However, if we didn't provide any insulin automatically and it's ahead of the meal, it will deliver whatever you ask it to deliver.
All right. Thank you for that. Courtney, I'm coming to you. Do I need to use my arm with the Guardian 4 sensor?
So the Guardian 4 sensor is FDA approved for use on the arm.
Thank you. Ali told you you'd be popular. Okay, so how does the system work during exercise? Is there anything I can do to decrease the insulin my pump delivers during activity or times when I don't need that much insulin?
Yeah, this is a great question. And, usually we don't go into this level of detail as part of these, but I'm glad someone brought it up. We actually have what we call a temp target built into the device. It'll set your target to 150 milligrams per deciliter, and it's time programmable. So you can make it stay at that target for up to 24 hours. And while you're in that temp target, we actually don't provide the auto corrections as well. So it'll give you basal insulin, but it won't auto correct, because depending upon the type of exercise you have, the last thing we would want to do is provide too much insulin and then create a hypoglycemic event. So what we've been recommending for people, but of course it depends on the type of exercise you're going to do, is to turn on that temp target an hour ahead of time. And then as a result of that, depending upon how strenuous your exercise was, leave it on for the appropriate amount of time to recover accordingly, and then all should be fine and good.
Great. Okay. And Vita, coming back to you. How do I get the link sent over to me again to help me upgrade from 770G to 780G? And also, can I get help with this process? I don't feel like I have everything I need.
Yes, so a couple different pieces to that. For the link, you will get when you get your upgrade and you've gone through the entire process of us processing your order and making sure that we have a prescription on file. There will be a software upgrade kit that is mailed to you, and that will have the instructions for use, but also a software upgrade booklet that will have all the instructions on what you need to do. Prior to being able to upgrade, a key thing here is that you'll need to finish training on diabetes.shop. It's about 45 minutes. There are 2 courses in that, and once you complete both of those, then the upgrade will be available, and you can follow those items that are in the booklet, even if you've misplaced the email or can't find it. That being said, if you also call our digital resolution team, they'll be able to send that email back to you so that you can get that link. But all the link does is send you to our software upgrade instruction booklet, which is also included in your IFU packet. Through that, we know that sometimes that software upgrade process, you want some help, and we, again, are here to support you. So our digital resolution team can provide that support at any step in the process, or if you have any questions, please feel free to reach out to them, and they can provide that support throughout the entire piece. And they will also provide that support if you have any questions during the training aspect as well.
Thank you, Anvita. Courtney, I'm coming to you. Autocorrections sound wonderful. I love that. Should I still take a bolus to cover my meals though?
So trust me, the autocorrections are wonderful, but it is recommended to bolus about 15 to 20 minutes before you eat for optimal control.
Wonderful. Thanks for that. All right, back to Ali. How many autocorrections can the system deliver in an hour?
Given the fact that we deliver them on a 5-minute to 5-minute interval, technically you can get up to 12 in an hour. Now, what we usually see is that the algorithm is constantly checking to make sure that the amount of insulin it's providing is safe. And so as a result of that, it may not always be 12 within an hour, maybe less than that, because it's checking, making sure everything's okay, and then continuing. But it can, and I've seen it happen quite a bit, it can deliver up to 12 in an hour.
All right, great. And Vita, how do I get the Guardian 4 sensor, Guardian 4 transmitter?
Great question. So to get the Guardian 4 sensor, you can either place your order on diabetes.shop or call our team. So that's 1-800-646-4633. If you are new to the pump or you need a new pump, along with that, you would select option 3. Otherwise, you can contact our resupply team to do that. A little bit more information on that piece is that with Guardian 4 CGM, the transmitter and the sensors, we do need a prescription. So once you place your order, we'll contact your HCP to get that prescription. And depending on your insurance plan and whether you need an authorization or any other documentation, the team will work to get that and then process your order. But during any of this process, if you have any questions or want to check the status, please contact us and we will make sure that we get you an answer right away.
Thank you, Anvita. Ali, I think I'm coming to you for the last one so that we can then wrap up. Can you just explain meal detection technology one more time? You said the missed meal correction is determined by the rate of change as well as past insulin delivery history. How is past history calculated?
Yeah, so the device is actually taking a few things into consideration to decide. It's actually first and foremost trying to find out what your total daily dose is, and then as a result of that, measure or see if that excursion in the glucose adds up to how much total daily dose you typically would see. So that's one component of the check. The other, of course, is the check of how much the rate of change is, and then the last check is just timing of when it's occurring. And so it's doing all of this to decide whether or not there is a meal, in fact, or not. Now, going back to this total daily dose, it's actually calculating that based off of a 6-day average for you. And that's intentional, and we didn't make it weekly so that it could see variations in weekends and weekdays more readily so that it could actually be more accurate. And then it's also looking at the day before as being more powerful than the 6-day past. And so all of this information is going into deciding whether or not a meal has been detected and kind of looking at your patterns to see if this is familiar or unfamiliar to us, and then providing the insulin based off of that.
Great. Thank you. All right. So in an effort to just get everybody out of here on time, we're going to go ahead and wrap. I want to thank everyone that sent in questions through Slido. And I also want to thank our panel for providing the much needed answers. We wouldn't be able to do it without you. But then as always, we cannot wrap without asking you to let us know how we did. We want to hear from you. So please scan this QR code to take a quick survey. Let us know your thoughts about today's live stream. We are always eager to learn about how we can improve your experience. Every time you let us know, we make sure to pull in those insights and apply them for the next program. So again, we would not be able to do this without you. Go ahead and take a couple more seconds. Let's leave that up on the slide. I feel like we usually just run through this and we really want to hear from you. And then while that wraps, or while we just kind of close things out, I do want to thank the panel. I want to thank all of you on behalf of Medtronic for joining us to learn more about the MiniMed 780G system. We really do appreciate it. The time commitment isn't lost on us. We know it's a little bit of time out of your busy lives to come and sit with us and learn about our products. So we are so glad that you took the time to spend with us today. We hope that you're walking away feeling as excited as we are about this incredible new technology. And then until next time, I can't believe I'm saying this, but happy holidays and take care, everybody. Bye-bye.